WFYI podcast brought to you by Bloomington, Indiana, an American college town offering food and drink, college sports, outdoor activities, live music, cool art, and good times daily. Everyone is welcome in Bloomington. More information at visitbloomington.com.
WFYI podcast brought to you by 45, presenting 30 years of music by the Mavericks on Saturday, August 17th at Rock the Ruins at Holiday Park. Ticket information at rocktheruins.com.
This is WFYI News Now. It's March 8th, and I'm Darian Benson. On today's show, a state house bill that could limit the governor's power on disaster emergency declarations. And substance use and overdose deaths continue to be a problem for young people. We'll have a feature story on how experts hope school prevention programs could help.
Your alcohol and tobacco curriculum can probably stay pretty much the same, but your curriculum around opioids and overdose and street drugs needs to be, you need to be able to update that to what's actually happening now.
Those stories coming up, but first, Lake Michigan and the rest of the Great Lakes haven't had much ice this winter. According to the independent research and reporting collaboration Climate Central, Lake Michigan is frozen for 22 fewer days now than it was in the 1970s, and ice cover is less than what it used to be. As Indiana Public Broadcasting's Rebecca Thiel reports, less ice can spell bad news for Indiana's lakeshore towns.
That ice serves as a barrier, preventing big winter waves from crashing against the beach, eroding roads and infrastructure for homes. Donna Norkus is on the town council for Beverly Shores. She says though the town hasn't seen as many storms this winter, erosion is an ongoing problem. Beverly Shores is working with other cities along the Great Lakes to look for long-term solutions and the money to pay for them.
The solutions that have been proposed are in the several multi-million-dollar range, which a town of 500 homes can't afford.
Less ice also puts more moisture from the lake into the atmosphere, leading to more lake-effect snow. For Indiana Public Broadcasting, I'm Rebecca Thiel.
It's now up to Governor Eric Holcomb whether to sign a bill into law that will restrict his power and that of his successors from extending statewide disaster emergency declarations. The legislation, given final approval by the Senate yesterday, is seen by some as a reaction to Republicans' continued frustration at Holcomb's handling of the COVID-19 pandemic. Right now, the governor can declare a disaster for 30 days and renew it, a month at a time, without any limit. Such declarations trigger the governor's emergency powers, which can be quite broad. The bill headed to his desk would now allow the governor to declare a statewide emergency for 60 days. But renewing it would require authorization by the General Assembly. Some Democrats worry the measure could put in jeopardy access to federal relief dollars, since they're typically tied to state disaster declarations. And for our final story today, the number of young people between the ages of 10 and 19 who died of an overdose has more than doubled from 2019 to 2021 and continues to rise. Some say school prevention isn't keeping up. For reporter Alex Lee, SideFX Public Media's Farah Yusri brings us the story.
A potent synthetic opioid called fentanyl was behind the vast majority of those teenage overdose deaths in the U.S. Kids can receive a pill laced with fentanyl when they buy opioid pain meds or prescription stimulants on social media. And even a tiny amount of fentanyl can kill. Chelsea Shover is an epidemiologist at the University of California, Los Angeles, who studies substance use.
Especially in the era of fentanyl, with experimentation, plenty of kids die because they just don't know that that's a risk.
Studies show that school-based programs are one of the most effective ways to reduce substance use and overdoses. But Shover says schools are slow to change and adapt.
Your alcohol and tobacco curriculum can probably stay pretty much the same, but your curriculum around opioids and overdose and street drugs needs to be, you need to be able to update that to what's actually happening now.
Research shows that schools often have more robust processes in place to react when a student is known to use substances. Prevention often takes a back seat. And it's not just about telling kids to say no to drugs. Ideally, it should give kids facts about the health, social, and legal concerns that come with substance use. Ellen Quigley is the vice president of the Richard M. Fairbanks Foundation. It funds prevention programs in more than 100 Indianapolis schools.
So when you're talking about substance use prevention, what you're really talking about is helping children develop the skills and competencies to withstand the pressures and to be able to prevent them from starting to use substances in the first place, or at least, knowing where to turn. And those kinds of skills get built up very early.
Skills like conflict resolution, how to make friends, and how to deal with bullying. The messenger is also important. Shover at UCLA says kids may be reluctant to ask for help from people who can get them in trouble, like teachers or police officers.
Drug education, it's partly to tell students about what's going on and what tools are there and what risks there are, but it's also to open a conversation for students who are struggling either themselves with substance use or their friends are.
Students have more trust in people like doctors, nurses, and nonprofit workers, studies show. But integrating prevention programs requires time and money, which schools say they don't usually have. Logansport School Corporation is a school district in Cass County, Indiana. It's a rural part of the state with a below-average income level. The county has seen a steady increase in opioid use. Jennifer Miller, the principal of the junior high, says the school couldn't keep some prevention programs going because there wasn't enough funding.
There used to be a program through Fort County that would specifically address substance abuse, vaping with the junior high level kids. And so that doesn't exist anymore, but there is such a need for it.
Now, tens of millions of dollars are coming to states across the country. It's part of a major settlement with opioid manufacturers and distributors for their role in the opioid epidemic. There's also federal and state funding available. Logansport School District and a federally qualified health center, Forsey Health, got $1 million in federal funding a few months ago. Lisa Willis-Gidley is the chief revenue officer at Forsey Health. She says they depend on such grants because prevention programs are not covered by insurance. Still, she says, implementing effective programs can be a challenge.
Schools don't have a ton of time. They've got to focus on their goals and their academics. And so you have to look at, can we give them these pieces of valuable material in a manner that's not going to be totally disruptive to their academic goals and performance?
Prevention programs are just one tiny but crucial task that schools need to fulfill. Experts say federal and state legislation can help set standards for substance use education and ensure there's enough funding for schools that need it. I'm Farah Husri, voicing for Alex Lee, Side Effects Public Media.
One of the sources in the story works for Richard M. Fairbanks Foundation, which is one of several financial supporters of WFYI, and we interviewed her as we would any other source. We also want to share that the story was reported by Alex Lee. He was a local and regional health reporter at WFYI, WBAA, and Side Effects Public Media. He was a beloved part of our newsroom, and he passed away last December. This was his last story. That's all for today's episode of WFYI News Now. Our podcast is produced by the following people who live in your community: Abriana Herron, Daudelin, Kendall Antron, who composed the music for this podcast, and me, Darian Benson. Our news director is Sarah Neal-Estes. If you liked today's episode, remember to subscribe and share, and follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back on Monday.